Good afternoon, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about yoga exercise for dentist back pain part 1. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It's your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about yoga exercise for dentist back pain. If you have any question about this topic, please feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing our speaker, Dr. Linda Sutarjo. Dr. Linda is a dentist, mindfulness coach, and holistic health practitioner. She has completed her graduation BDS from the University of Padjadjaran, Indonesia. She was a speaker in more than 15 seminars. Dr. Sutarjo views healthcare and disease as a part of nature which needs proper balance. She knows how to address a combination of mind, body, and soul to treat the whole person. Welcome, Dr. Linda. It's our pleasure to have you with us.
Okay, thank you, Dr. Sarah. Good evening, doctor. How are you? Hopefully you are in a good health and happiness. And first of all, allow me to thank to all participants that attending this live webinar and also to the management of DentistChannel.Online for giving me the opportunity to share yoga practice for dentist back pain. So may I share my screen? Allow me to share. Okay, just a minute. Okay. Have you ever heard about dentist pain or dentist back pain? Have you ever had this pain? Hopefully not. Sadly, the dentists are at high risk for neck and back pain. Why? Because the awkward working posture, repetitive work, and prolonged standing can result in damage to muscles, joint, bones, ligaments, tendon, nerves, and blood vessels, which can lead to pain, fatigue, and various musculoskeletal disorders like neck pain, shoulder pain, and low back pain. Okay, so low back pain is the most frequent complaint, and almost all dentists worldwide have experienced this pain during their careers. So what is the low back pain? Okay, let's see the spinal. So the lumbar spine or low back is a remarkably well-engineered structure of interconnecting bones, joints, nerves, ligaments, and muscles, all working together to provide support, strength, and flexibility. However, this complex structure also leads to low back, susceptible to injury and pain. And what are the causes of low back pain? Most commonly, the mechanical issues and soft tissue injury are the cause of low back pain. These injuries can include damage to the intervertebral disc, compression of nerve roots, and also improved movement of the spinal joints. And what are the mechanical factors? It can be traumatic, like fracture, and degenerative process, such as spondylitis, osteoarthritis, and also herniated nucleus pulposus. And what are the non-mechanical factors? It can be metabolic disorders, such as osteoporosis, neoplasms, such as spinal tumors, river pain from kidney, autoimmune, like rheumatoid arthritis, and infection, such as osteomyelitis and tuberculous spondylitis. And what common symptoms? Low back pain is typically characterized by a combination of the following symptoms, like dull, sharp pain, stiffness, numbness, tingling, and also weakness. And pain can travel to the buttocks, legs, and feet. We call it sciatica pain. And also the pain can be worse after prolonged sitting and also can develop slowly, immediate, or delayed. And why and how we can diagnose the low back pain. As a foundation of the diagnostic process, the patient provides a detailed description of symptoms and medical history. From patient history, like activity level, sleep habits, postures, and injuries. And from physical exam, we can know from palpation, range of motion, reflex, leg raise test. And from diagnostic imaging, we can use X-ray, CT, myogram, or MRI. And how about the treatment? Okay, depending on the patient diagnosis, some treatments may be more effective than others. Many people find that the combination of treatment is best. Treatments include early treatment care at home, medical treatment, and alternative care, or even surgery. We will see the early treatment care that we can use it. Self-care is administered by the individual and can easily be adjusted by yourself. These methods include short rest period, deep relaxation, hip or eyes therapy, lumbar corset, and also exercise such as stretching and strengthening. Okay, and for the medical treatment, the goal of medical treatment is to reduce pain, but these treatments do not change the underlying source of pain. Common medical treatment include analgesic, non-opioid, narcotic pain medication or opioid, and epidural steroid injection. And how about surgical treatment? Spine surgery is usually not recommended for mild to moderate back pain, or if the cause of the back pain is not detectable through imaging tests. What are the type of the back surgery? It can be decompression surgeries, lumbar spinal fusion, lumbar artificial disc, and posterior motion device. And also the alternative treatment. Non-medical treatment may be referred to as an alternative or complementary care. Many patients with back pain report relief from alternative treatments. Common options includes manual manipulation like chiropractor, acupuncture, massage therapy like acupressure, and mindful meditation like yoga. So, what about yoga? Okay, and now we will know about yoga. As Dr. Lauren says, she is a medical editor of the Harvard Special Health. She says that yoga helps strengthen and stretch back muscles that might be tight. And then yoga is a gentle practice that is ideal for maintaining back strength and flexibility. It's also one of the more effective tools for helping reduce low back pain, the most common source of the pain and disability. And what are the benefits of yoga? Dr. Natalie Nevins, a certified osteopathic physician in Hollywood, says that the purpose of yoga is to build strength, awareness, and harmony both of the mind and the body. So, the benefit for your mind, regular yoga practice creates mental clarity and calmness, increased body awareness, relieves chronic stress patterns, relaxes the mind, centers attention, and sharpens concentration. And also self-awareness or particularly can help with early detection of physical problems and allow for early prevention action. And what are the benefits for the body? Yoga can lessen chronic pain such as lower back pain, arthritis, headaches, and carpal tunnel syndrome. And also yoga can lower blood pressure, increase flexibility, increase muscle strength and tone, improve respiration, energy and vitality, maintaining a balanced hormonal secretion, increase digestion health, cardio and circulation health, and also protection from injury. So, how can yoga help reduce back pain? Yoga involves a series of poses, also called posture or we call asana, and emphasizes breathing techniques. The posture teaches you to stretch and strengthen your muscle, which help reduce muscular tension, build flexibility and strength, and also improve balance and bone strength. What is posture or asana? Asana essentially work to lubricate the muscles, joints, ligaments, and other parts of the body. This helps to increase circulation and flexibility. Practicing daily asanas can boost up energy and also improve health. They also help better the internal body. How is different asanas work on different internal parts of the body? And what are the types of asana? It can be standing pose, core, arm balance, back bends, twist, forward bends, hip opening, and inversion. And what about the breathing or pranayama? Pranayama or breath control is a main component of yoga. It's frequently practiced with yoga posture and meditation. The goal of pranayama is to strengthen the connection between your body and your mind. According to the research, pranayama can promote relaxation and mindfulness. It also prevents to support multiple aspects of physical health, including lung function, blood pressure, and brain function. And what are the types of pranayama? So many types of pranayama. We know that there are samaviri pranayama, or we can use inhale, same the time from the exhale. Inhale 1, 2, 3, 4, and exhale 4, 3, 2, 1. And for Visamavritti, it's inhale more shorter than exhale. It can be make your nerve system calm. There are Kumbhaka inhale, hold, and exhale. Also Viloma, interactive breathing. And also Sitali, use the tongue, make it roll, and use the space of your tongue. Inhale from the space. And Sitkari, we use the tongue, gap between the teeth. It makes our nerve system more calm too. And also there are Nadi Sodhana or nostril breathing, Surya Badana, Chandra Badana. Use the whole of your nose. And also there are rapid forceful. It can be used to detoxification. And also the Brahmari or humming bee. We can we use or making sound when we exhale, like a sound of bee, like that. And the last is Ujjayi breath or deep throat breathing. It's the types of pranayama. And then, what about the meditation? Meditation is considered the type of mind-body complementary medicine. Meditation can produce a deep state of relaxation and calm mind. When you meditate, you may clear away the information overload that builds up every day and contributes to your stress. Meditation can give you a sense of calm, peace, and balance that can benefit both your emotional well-being and your overall health. And what types of meditation? Meditation is very grounded and effective way to release stress while also promoting self-awareness. Just as there are many different reasons why people meditate, there are many different kinds of meditation. Knowing some about them can help us choose which one the type of meditation is right for us. Five of the most common types of meditation are mindfulness, body scan, walking or moving, and loving kindness meditation, and also transcendental meditation like spiritual meditation. Now we will see Yeah, the posture or the asana. This is when the back pain comes, the most helpful posture is Savasana with bolster. We use the bolster behind your tailbone and then support your neck with the blanket. This is very, very comfortable if you have a back pain. And then if the spine more comfortable, you can practice another asanas like this. This is for strengthening your spine and your feet. And then also there are poses that release your spine, Supta Balasana, like this. And also strengthen and stretch your spine also with Ananda Balasana pose. And then Suchirandasana or middle thread pose. It will help your sciatica nerve too. It will stretch the sciatica nerve. So the sciatica pain is relieved. And then twisting pose, Jatara Parivartanasana. This is very, very comfortable for after during practice day long. And you can try it tomorrow. We can try it tomorrow. And also this Balasana pose or child pose. It is very comfortable for lengthening your spine and relax your spine. And then also Anahata pose. It will help your circulation, improve your circulation. And also, this is also the most helpful. This is more comfortable if you already practice all day long. This is the favorite pose. And also, yeah, use or stretch your back with the Salama Bhujangasana or spin pose. This is will help you too. And also stretch your gluteus or your muscle of feet. And also this is the cat ankle pose. This is the favorite pose too. We can use this pose for make the spine naturally. Inhale, you will drop your spine or your belly. And when you exhale, you will roll up your spine, raise up. And then we can use another pose. This is a pigeon pose. We will try it tomorrow. And also kneeling pose, Parigasana. It will help strengthen your knees and also your spine. And also Pasistasana pose like this. And twisting pose at sitting. This is the pose that will help you. This is for shoulder. And if you want to exercise at the clinic between the schedule of your patient, you can try some stretch, simple stretch from the neck. You can gaze your face to the floor and up your face. And then you can stretch to the side and also stretch your fingers. It is useful for prevent the carpal tunnel syndrome. Okay, you open your fingers and close. And then you can see this. This is also for carpal tunnel syndrome. Stretching your hand or fingers or palms. Okay, and then also this is for Garudasana or for your shoulder and also the twisting. And this is for your sciatica too and for your spine too. Okay, and the last pose is for your spine and for your legs. This is very, very comfortable pose. And that's all presentation from me. Hope it will make you healthy from and away from the back pain. Okay, and back to Dr. Sarah. I will stop share my presentation. Thank you all, and tomorrow we will meet to practice together. Thank you.
Thank you so much, Dr. Linda, for this interesting webinar. So meanwhile, I will ask your permission to introduce our company to all the participants. And I request all the participants to kindly put their questions in the question and answer box if they have any. So this is our organization, DentistChannel.Online, Healthy Smiles, Wealthy Lives. I request all the participants to kindly save this number and send a message on WhatsApp with their name, so they will be added to our broadcast list, and then they will receive everything about our upcoming webinars, workshops, and courses. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implant types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced mainly all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. Those are the offers by NovaMind, and if you have any question, if you want to see more, kindly check their link, novamind.gmbh. About our upcoming dental webinars, we have the practice session of today's webinar happening tomorrow at 7 p.m. Indian Standard Time. We have next week a session with Dr. Karam Korea from California. He will talk about treatment options for a missing tooth. And we have a session by Advocate Samudrala about legal aspects of dental practice, part 2. If you haven't checked part 1, you can find it on our Facebook page or on our YouTube channel, DentistChannel.Online. About our upcoming dental workshops, we have an online workshop about short dental implants with Dr. Himang Zala. The course highlights detailed online lectures, international certification, recorded sessions, WhatsApp mentorship, assignments, and more. About our upcoming dental courses, we have a course with the International Foundation for Implant Dentistry and Dr. Kumar about corticobasal implantology. We have demonstration, live surgery, hands-on, and much, much more. Last but not least, I would like to invite you to join our second World Implant Expo 2021, happening on 5 November via virtual platform with more than 30 speakers, 30 CPD points, and live interactive sessions. I added the registration link of the World Implant Expo in the chat. You can find it there. If you have any question, you can always call or WhatsApp this number or visit our website for more information. If you're not a Prime member yet, kindly join our family to get free certificates of participation after every event and also get exclusive discounts on online dental courses, on-site dental courses, hands-on dental courses, events, workshops, and a lot more. Please don't forget to follow us on our social media platforms, Facebook, Instagram, YouTube, and Twitter. Okay, so now we can move to the question and answer session. Dr. Raisa is asking how much time after eating a meal can we do yoga? Dr. Linda, can you hear me?
Yes. For the first question, can you repeat it?
How much time after eating a meal can we do yoga?
Okay. The time to doing yoga is suggested for empty stomach. It can be 1 or 2 hours before or after meal. You can do it in empty stomach. It's a suggestion from us. It's can understand about the time. So 1 or 2 hours before or after meal. Is it clear?
Okay, yes, it is clear. Thank you. Dr. Aisha is asking, do we need special trainer for yoga or we can do it at home also by watching videos on YouTube?
Okay, actually, I suggested to have a personal trainer, but if you do the basic asanas, you can see on YouTube. The important thing of the yoga is not to mastering, but to make your body, your mind is comfortable. So if the asana or the posture is simple, basic, not use the inversion or the difficult, you can do yoga by yourself and can see only from YouTube. But for inversion or difficult pose, it's not suggested by doing by yourself. Is it clear?
Yes, it's clear. Thank you. We will wait
Thank
just a
you.
few minutes to see if any of the participants
Okay.
has a question or not. I think all is fine, all is clear. I request all the participants to join us tomorrow for the practice session. We will have a live practice session with Dr. Linda. We thank you, Dr. Linda, for sharing your knowledge and experience with us. And we are looking forward for the second part of this session tomorrow. Thank you so much. Thank you everyone for joining our webinar today, and we are waiting for you for tomorrow's webinar, also at 7 p.m. Indian Standard Time. Have a nice evening, everyone. Bye, doctor.